If you are one of the millions of people who suffer from migraines, you know how painful it is, how debilitating it can be, and how much you look for answers. Today, I am delighted to be talking to one of my dear friends and colleagues who may have an answer that you've been overlooking, and that is talking about vagal nerve health. So, my guest today is Dr. Navaz Habib. He is my go to resource for everything about vagal nerve health. He's written 2 books on the topic. He certainly is connected so many different ways to a number of different strategies that can help you. And today, he's going to shed some light on the things that we can do to hopefully improve our migraine health. Navaz, thank you so much for being here.
My absolute pleasure. Thanks for having me, Mira.
I remember when we first met at a conference and you were talking about vagal nerve health, and I was astonished because this is something that people just don't talk about. Can you share for anybody who's listening, what exactly is the vagal nerve?
Yeah, absolutely. The vagal nerve or the vagus nerve has numerous names, and it's funny we say the vagus nerve. We have two, which is amazing. So the vagus nerve is the 10th cranial nerve. Now we've got 12 pairs of cranial nerves. These are the nerves that stay in the head and neck area generally, but the vagus nerve is unique, and it's the 10th of those 12 pairs, comes out of the brainstem, follows down along the carotid artery and jugular vein. It's got a few branches in the head and neck area to the muscles of the pharynx, the larynx, helps to maintain our airway nice and open, helps with the vocal cords. So the reason I can go really, really low or really, really high with my voice is because I'm tensioning and lengthening my laryngeal muscles using those vagal nerve fibers. It sends a small branch to the ear, the skin of the ear, and then as it continues down through the neck, alongside the carotid artery and jugular vein, which is a clue as to why this nerve is both unique and important. It then follows down into the chest, into the thorax area, where it connects to the esophagus, the trachea, the lungs, and the heart. Very importantly, it does have very strong, important control over the heart to lower the heart rate, to slow everything down. But that's not where it stops. It continues down along the esophagus, follows through the diaphragm into the abdomen, into the belly area, where it attaches to virtually every single visceral organ that we have. There is no other nerve in the body that does anything like this. The vagus nerve is unique. It's actually called vagus, coming from the root word vague, because anatomists saw this and they said, this nerve goes everywhere. It's vague, it's wandering. We don't know what this is doing. And they didn't understand the microbiology of it and looking at the microphysiology of specifically what is this nerve signaling to? What type of cell is this trying to relay its information to? Now, we're talking about migraine. We often have to say, well, what does migraine generally have to do with, my lungs and my gut and all of these things? Well, a lot, because the fibers on the vagus nerve don't generally go down. 80% of the fibers on the vagus nerve send information from all of those organs that I mentioned up to the brain. 80% is coming up. That's huge. Only about 15% of the information on the vagus nerve goes from the brain down to those organs. It's actually getting the information up to the brain, and that's where it sends its relay messages up into the central nervous system, into the cerebrum, into the cerebellum, into the hypothalamus, and has its important relay information that allows us to do very specific tasks. And we'll get into what those tasks are as we ask more questions.
So, that's fascinating to think that most of the information is going up. I think for many of us, we think it's a two-way path. And I'm also astonished to realize just how many of those nerve endings are up in that neck and head area. Is that part of why it contributes to migraine architecture? Because there are so many of those endings there?
The endings play a massive role, but it's not necessarily due to the number of them. We are realizing more and more that when we look at the root cause of what causes migraines to occur, we're looking not necessarily at the neurons. We're not looking at the brain specific cells, the ones that we've generally put as brain cells being the neuron. It's actually the microglial cells and astrocytes, the immune cells that are present in
Mm,
the brain area. Those cells are the ones that are far more relevant when it comes to the symptomatic nature of a migraine
mm,
and for a lot of other chronic diseases as well. This is not just a specific to migraine type of condition issue. It's all about the inflammatory control piece. How well can inflammation be controlled in the body is really the underlying question that needs to be asked of every chronic disease sufferer, especially somebody who has these acute, severe migraines. We're looking at the immune cells, and there are immune cells that are present in every single organ of the body. Should be a clue as to what the vagus nerve is actually trying to signal to. We have these cells called tissue resident macrophages that are present in every single organ of the body. They're very differently named in every organ, but they all have very similar functions, which are to regulate and optimize the function of that organ. In the
mm,
brain, they're called microglial cells, the microglia. Okay, if you've ever heard anybody talk about brain inflammation, concussion injuries,
mm,
headache, migraine, microglia are always there. This is the tissue resident macrophage of the brain. They help to regulate the connections between neurons. They're wrapped around and present at every synapse, making sure that the synapses are working well, making sure that the brain neuronal connections are effective and working well together. In the liver, they're called the Kupffer cells. In the lungs, they're the alveolar macrophages. In the heart, they have a different name. In the skin, they're the Langerhans cells. These are tissue resident macrophages that are actually the first immune cell, the first cell to differentiate when we're developing as a fetus. So when we go from a clump of cells to something that's starting to differentiate, the first cell type that differentiates is a macrophage. And those macrophages go to different areas on the fetal development area, on the somites, and they actually produce and allow for the organs to grow around them. And it's those
mm,
macrophages that then persist and maintain the function of those organs as we grow into an adult, as we grow into an old person. Those macrophages, those same tissue resident macrophages, they've obviously cycled in terms of their life, but they are still present in every
mm,
single organ. So immune cells have been given a little bit of a misnomer as being just there to protect us from external threat.
mhm,
But in reality, they do a lot of maintaining and regulating the function of every organ really effectively.
mm,
But it depends on their state. Their state is dictated by, are there threats to my survival that I need to fight off? Or can I be here to help regulate and optimize the function of this specific organ? So in the brain, the microglia are generally there maintaining and managing synapses and making sure that threats aren't coming in and ensuring that our brains are functioning really well. But anybody who's ever experienced an acute migraine or brain fog or cognitive dysfunction or memory issues, you'll always go back to say, man, my brain just is not functioning well. You
mhm,
feel like the connections aren't there, the words aren't at the tip of your tongue, right? You can't remember the specific instance where you're trying to remember. You know there's something there, but there's something that is missing. There's a missing piece to that puzzle. This is microglial activation in a state of threat response. And we need to figure out which state we're in. And we need to then send a signal to those cells to say, no, we don't need to be in threat response mode right now.
mm.
Let's shift back to regulation mode. We don't need to be in fight mode. We need to be in fix mode. And there's one way we can change that very effectively, and that is through the vagus nerve. When the vagus nerve signals effectively, when the nerve is working correctly and sending its signals out effectively, it uses a neurotransmitter called acetylcholine to send a signal to these immune cells, to these tissue resident macrophages, the microglial cells in the brain, to say, we don't need to be in fight mode. That acetylcholine attaches to the receptors on that cell and it turns on a specific cascade within the nucleus to shift it to become a fix macrophage, a fix microglial cell.
So it's
Goes
calming it.
from
It's
it
calming
calms
because,
exactly. It
mm,
calms it down so you're not in this constantly checking, making sure that there's no threats mode. You're shifting to a mode of fix, regulate, optimize. And that is often the key missing piece when it comes to chronic disease. That we have too many cells that are pushed into that fight state, immune
Mm.
cells, and they're not being regulated and pushed into the fix state. And so when it comes to migraine, this is exactly what's happening in an acute and rapid manner that's causing the symptoms of a migraine to occur. We're stuck in this fight zone, and it takes a long time to get out of that.
And it's so interesting because I know for so many people who struggle with migraine, it's coming. Like you can tell it doesn't just hit you out of nowhere. You can tell it's building. And sometimes you manage to get on top of it, perhaps with medication or other strategies, but it takes a while for the system to respond. And then once it happens, it's really difficult, like you said, to downregulate. I know for myself, when I was at my worst migraine history, where I was having a lot of them, literally I had to throw up and lock myself away in a dark room and just sleep it off. Is part of that because of how long it takes the body to shift into that fix mode?
Yeah. So what you were doing when you're going into the dark room and you're throwing up and you're getting rid of potential toxins that are entering your body, you're getting your body into a state. You're creating an environment in which your body has to shift back to a fix mode, into this parasympathetic mode. Okay.
Hmm.
So the fight mode in those immune cells correlates very directly with the sympathetic state. So we have this autonomic nervous system, which is the nervous system sends signals to all of our organs in our body that shift us between, do we need to be in fight mode or do we have this ability to go into fix mode? The fight mode is like a fight or flight state, and that's the sympathetic branch of the autonomic nervous system. On the opposite side of this, we've got the parasympathetic nervous system. And the parasympathetics are the rest, digest, recover, fix mode. And
Hmm.
that's what's signaled through the vagus nerve. So when you're doing these practices, these lifestyle practices of, oh my goodness, I feel it coming, this thing is going to drive me crazy, I need to put myself into a mode where there's no new potential markers that we're going towards sympathetic state. You're going into a room with no light, so calm, relaxed. The vagus nerve turns on in dark, just as a fun little side note. It turns on in dark, and it specifically is most active when you're asleep. So sleep is huge for vagus nerve health. When you go and you throw up, you're trying to get rid of any potential toxin, any potential burden to your leakiness of your gut so that you can allow your body to enter that, not necessarily digest mode, but get your body into the rest and recover mode of that parasympathetic branch, because we don't want to have an active digestive process that's occurring, because digestion is very energy intensive.
Mm.
So in those instances, you're trying to create all of the circumstances in your environment that help shift you to parasympathetic.
Wow.
Well, there are tools that you can use and breath patterns and devices and technologies that are coming out that are very, very powerful in stopping that shift without needing to create as many of those environmental changes.
Hmm. Wow. So here's another interesting question to me. I come from a family of migraineurs. I gave birth to migraineurs. I know it tends to go in patterns sometimes.
Yes.
One of my children struggled deeply with abdominal migraine. And so
Mm.
I learned that there are actually a significant number of people who will experience migraines in the abdomen. Is it because the vagal nerve runs between the both that it can appear either in the head or the abdomen?
Have you ever heard, and I know you have, so I'm just kind of doing this for everybody else. If you've not heard of it, the gut brain axis
Yeah.
is made up of the vagus nerve. And so a
Hmm.
lot of triggers for migraine in the head, in the brain area, actually come from the gut.
Hmm.
Where you're feeling the symptoms is going to be secondary. So abdominal migraines are actually happening because we have immune cells in the lining of the gut. Same exact
Hmm.
idea. It's just where the activation, where that that specific sympathetic fight or flight activation is occurring, localized, and where that experience of inflammation is occurring. So
Mhm.
when we have this fight state activated, and here's a fun stat for everybody. 70% of our immune cells by volume within our entire body are lined in the gut, in the lining of the gut. That's where they're present. That includes the gastrointestinal macrophages,
Mhm.
right? The macrophages, those tissue resident macrophages that we spoke about, they're located in the lining of the gut. They're there maintaining the function of the gut barrier, right? Leaky gut syndrome, the breakdown of the epithelial lining across the entirety of the gut, that's meant to be shut down. The leakiness is supposed to be stopped by those macrophages, but only when those macrophages are in a state of fix, of rest, digest, recover, healing mode. You can't heal when you're stuck in fight or flight,
Mhm.
right? We need to be able to create that shift. So these immune cells that are located in the abdominal lining can be triggered as well. Now, whether those symptoms take place within the abdomen or the brain, in your family that it seems incredibly random, right?
Yeah.
But it honestly doesn't matter because the pattern is exactly the same. It's
Mm.
just where are the symptoms taking place, right?
That's such a good point. And so that actually leads to the next question, which is if you're somewhere along the line of whatever represents the beginning patterns of a migraine for you, what are some of the things that you can do to support that vagal nerve and hopefully either ward it off or at least calm your response and hopefully lessen your migraine intensity?
You know that our bodies are constantly shifting between sympathetic and parasympathetic. We're always shifting generally, and both of these systems are always on sympathetic, parasympathetic. But the balance needs to be there. We need to be obviously on this like ideal balancing act. And what happens in a situation of activation where you start to feel these acute symptoms coming on is we're slightly tipping the balance towards sympathetic.
Mm,
And when we slightly tip the balance towards sympathetic and there's a little less parasympathetic, a little less vagal tone activation occurring, we're sending more signals to the immune cells to go into that fight mode,
mm,
right? Or we're decreasing the number of signals to go into the fix mode, is really what's happening. So we're creating this tipping towards a sympathetic state. So, what can we do? Everything in our power to turn on that vagus nerve, everything in our power to shift that balance back to at least balanced, if not heavily parasympathetic. Okay.
mm.
And so, what are some of the ways to do that? Let's talk about what specifically is allowing the vagus nerve to be on. And the number one thing is our breath. How we breathe is key to this. Our breathing pattern is very interesting. We'll go back to this little teeter totter.
Seesaw.
Yeah, seesaw. Okay. So we've got the seesaw, and when we inhale, we're going slightly sympathetic, right? So
Mm,
think of it as you hear a loud noise or you see a flash or something bangs around you. You immediately are going to go, what's going on around me? And you take an inhale with your breath, your eyes, your pupils widen, you go into a state of let me look around. What threat do I need to respond to? And you go into a threat response mode, right? And you become aware. And sympathetic's necessary for that. You can't go into a threat response mode and be completely chilled out in parasympathetic, vaguely activated state. It's counterintuitive. So we make a shift towards sympathetic. So when we inhale, we're actually very slightly tilting the pattern towards sympathetic activation. So if inhale is sympathetically activating, the opposite is going to also be true. Exhales are parasympathetically activating. They're vagal nerve activating. And so you can imagine as that threat goes away, the loud sound that you heard turns out to be nothing major, or the flash of light turns out to be nothing major. You go, and you do a sigh of relief. That's literally a shift towards the parasympathetic side. So our breath, when patterned effectively, is going to be a seesaw that is balanced generally. But when we're breathing in or we're taking longer time in inhale than we are in exhale, we're slightly teetering towards sympathetic threat response mode. And so we're decreasing the number of signals that are coming in from the parasympathetics from the vagus nerve, and we're not allowing the immune cells to go into
Fixed
rest,
mode.
digest,
Yeah.
recover mode, fix mode. So let's start taking breaths that are longer exhales. So the breathing patterns that we recommend here are going to be three things. Number one, longer exhales. We talked about that. Number two, nasal, through the
Mhm.
nose. Breathing through the nose is huge, and people don't realize this. We have hairs in our nose, we have teeth in our mouth. We don't eat through our nose, we filter air. We shouldn't breathe through our mouth. We don't have the filter in our mouth. It's there as a backup, right? It's
Sure.
great as a backup plan. But the nose is the breathing tube, the mouth is the eating tube. And that's where the ideal situation is for optimization. So we should be breathing through our nose. We should be taking longer exhales. And we have to use a very specific muscle to breathe correctly. And I've
Mm.
mentioned this muscle already, but it's one that I'll go back to. If you remember, the vagus nerve, as it goes down from the beside the esophagus into the thorax and then continues down, it passes through a very important muscle called the diaphragm. The diaphragm muscle separates the thorax, which is the upper chest area, from the abdomen, which is your belly
Mhm.
area. And it's a massive muscle that overlays kind of the entirety of the abdomen, and that needs to be functioning. It is the prime driver of the breath, of our breathing pattern. But when we have this breath occurring using our diaphragm, we're creating a vacuum within our thorax to bring air in into our lungs so that we can fill up and get oxygen in. And then we're pushing it out using our diaphragm, getting the carbon dioxide out. In addition to that, because that muscle is so intimately involved in the pattern of breath, but it's so directly attached to everything below it, every
Mm.
time we use the diaphragm, we're actually massaging out and creating motion patterns within the organs below, right? So the stomach, the intestines, the liver, the spleen, they're getting this massaging effect. The kidneys, they're getting this massaging effect every time we're breathing diaphragmatically. So we want to breathe through our nose using our diaphragm. The best way to know you're doing this is with the belly breathing practice. So put a hand on your chest, put a hand on your belly, and check where your breath is, right? You'll always see when you're breathing with your belly, that's your diaphragm actually working and creating the pressure of pushing your belly out.
And
That's what we
pulling your
want
lungs
to,
down. So you
and
get,
pulling your lungs down and opening up the entirety of the lungs. Nasal, diaphragmatic, longer exhale. So the practice here is going to be 3 seconds in, 5 to 6 seconds out is an
Mm.
easy way to do it. It's not high pressure for a lot of people. Slow the breath down and go into more time on exhale than on inhale. 3 seconds in, 5 seconds out. You can increase that if you feel like that's not enough for you. 4 seconds in, 7 second hold, eight
Mm.
seconds out. Four,
Nice.
seven, eight breathing pattern is a really wonderful tool. It's actually a tool used by Navy SEALs to help them fall asleep in under 5 minutes. They use
Wow.
kind of three breaths of these four, seven, eight breathing patterns, and that helps them get into this mode, and they fall asleep generally within 5 minutes, which is pretty amazing.
That's wild. So I have a question about breathing then, because I
Yeah.
know there's an Ayurvedic practice that sometimes, like if I'm at a yoga class or whatever, they have us start doing alternate
Yes.
nostril breathing. Is one side more parasympathetic and one side more sympathetic, left and
Yes.
right?
And so creating balance is exactly what you're doing with alternate nostril breathing, right? Is you're trying to create balance, sympathetic, parasympathetic. You never want one far more active than the other. You want balance between the two, right? So if we're hypersympathetic, we're in a heavily stressed out state, right? We're in this fight or flight mode almost all the time. We all know somebody who's more sympathetically driven almost all the
Yeah.
time. We also know people that are too laid back and just don't make a move and they're just completely laid back and they're stuck in parasympathetic dominant mode. We want balance. It's like
Hmm.
a car. Okay. My best analogy for this is a car that has both the accelerator and brake pedals in the car. The accelerator is a sympathetic state.
Mm.
And without an accelerator, your car is a piece of junk sitting in your garage, not doing anything, not going anywhere. It's stuck. We need brakes. A car without brakes is a danger to society,
Mm.
right? It
Yeah.
can injure you, it can injure others. you need balance. You need both pedals to be pushed in incremental but balanced patterns to allow you to get to a place that you want to get to, achieve a goal, complete a task, whatever it is, and
Hmm.
then to be able to stop and recover. You can't fill your gas tank while you're driving along, right? You can't
Yeah.
even charge an electric car while you're driving along, right?
Right. You
Generally.
needed the regenerative
You
braking for
need to
an
slow
electric
down.
car.
You
Yeah.
need to use regenerative braking. You sound like a Tesla owner too. I have a Tesla as well. We need this balance between sympathetic and parasympathetic in the same
Sure.
way we need that balance between our breath patterns. So when it comes to those breath patterns, when we're using our diaphragm, when we're turning on nasal diaphragmatic long exhale breaths, what we're doing is we're creating that balancing pattern between the two because we're not heavily shifting one way. We're saying that for a period I was a little bit more sympathetically driven. Now I'm going to make sure that my vagus nerve turns on using this breath pattern.
Mm, very cool. Now, I know you and I have talked about this before, and I've
Yeah,
seen you share it at a conference. There's also a device that people can use to stimulate the vagal nerve to help support
yes,
other things like vagal nerve health in general. Does that device also work for migraines?
I have it right in front of me. This is the Truvaga device.
Mm,
Big fan of this particular device. And this is a tool that I have used with numerous patients, numerous clients, people that are just in need of support. And I love this device. Now, this particular device is only available in the US, but it is based on technology from the same company that is FDA cleared for migraines and cluster headaches
mm,
and hemicrania continua. So, not just migraine, but it does shut off the migraine very, very quickly for a lot of people. It's not 100%, but it's very, very good. And so this technology is available to everybody and it's really easy to use. Now, if you remember, I mentioned that the vagus nerve passes along the carotid artery and the jugular vein. Most people were probably like, why is he telling me the anatomy? I couldn't care less about the anatomy. Well, if you know it, then you can use it. And that's why I teach it. So I'm a chiropractor, so I have to teach the anatomy side first. The device is awesome. It's got two electrodes, one on each side. And the idea is you find your pulse and then you put the electrodes above and below directly on the area where your carotid artery and jugular vein and vagus nerve are all located. And you turn
right,
the device on. You obviously put on some gel, electrolyte gel for conductive capacity. And for 2 minutes, you will let that device turn on and
right.
electrically stimulate the vagus nerve. And what we've seen is massive reductions in acute migraine suffering. It actually can halt the aura. So if you catch it
Wow.
very, very early, those prodromal symptoms can be completely shut down using devices of vagus nerve stimulators like this. And because they are FDA cleared, they're very, very safe, which is really wonderful as well. So this particular device doesn't have any FDA clearances. The Truvaga is not an FDA cleared device. The Gamma Core, which is from the same company, is, but this one is accessible for everybody. And I think it's a great tool that has the technology of FDA clearance. So that would be a great device that in 2 minutes can have phenomenal results for a lot of people. And it's something that you can use not only for 2 minutes, if you need to, and we have acute protocols for this, do two, three, four stimulations in a
Hmm.
row to help get the vagus nerve signals turned on. What it's doing is it's electrically stimulating the nerve to send those acetylcholine signals more effectively. You're trying to, generally for a short period of time, acutely increase vagus nerve signaling so you can
Sure.
create that shift and push your body into that parasympathetic state, into that rest, digest, recover state, sending the signals to the immune cells that are hyperactivated in that threat response mode back into fix mode and
Mm.
regulate mode and calm mode. And people generally, one of the most common things I hear is, I just felt so calm 5 or 10 minutes after I used this thing.
Wow.
Or I haven't slept like this in 10 years. Or, I just feel like I'm so much more regulated with my emotions and I haven't had as many migraines and I'm doing much better. That's one of the more common things that I hear with my patients that are using this. And I don't think it's for everybody across the board, but the device and the technology, it's based on clear science and has phenomenal data out there as well.
And I have to say, as someone who used to have really horrific migraines, anything that helps lessen the intensity of a migraine is a winner. If it helps stop it, that's amazing. But even just being able to bring it down to where you're not debilitated is really amazing. And so this seems like a really good tool. And I will share for anybody who is listening to also remember all the different pieces and parts of the Migraine Masterclass where we're talking about food and hydration and holistically healthy habits. And so obviously paying attention to the health of your vagal nerve is a very key part of that. So I know for anyone who wants to know a little bit more about their vagus nerve, you have an amazing book. I actually put it into my book club. There it is, Upgrade Your Vagus Nerve. And I do highly recommend this book. Dr. Navaz is an amazing resource when it comes to vagal nerve health and all of the wonderful ways that we can support our body and our health by paying attention to this little known and perhaps under attention or under noticed nerve. So, Navaz, thank you so much for being here. Thank you for sharing all of this amazing information with our community. I really appreciate you.
My absolute pleasure. If anybody's interested, check out the book. Tons of info in there, lots of clinical case studies. You can follow me online and learn more. This is my mission in life is to get the vagus nerve out there and make sure that everybody knows how to utilize this tool, specifically the vagus nerve itself, how to harness its power and to live a more anti-inflammatory life. So, thank you
That
so much
sounds
for having me, Mira.
That sounds great. And I will put a link down below. So make sure that you look at the handout that comes along with this video. It will have a way to connect with Dr. Navaz. It will have his book, and it will also have a link to that Truvaga so that if you are interested in trying that out, you can get that for yourself. Thank you again. It was wonderful to see you. Thank you for being here. Thank you for watching this video and for supporting yourself and your migraine health by taking this step forward with the Migraine Masterclass. Thank you, folks.